going to direct my next question to Juliet. The question is, how are people who already have mental health disorders handling the COVID-19 situation, and how are they getting help? Specifically with this situation, I just want to highlight that a lot of doctors are not seeing new patients. So how do people access that care if they need it now?
So that is that's a tough question, because if you're not already plugged into a health system, then it can be really difficult to get plugged in somewhere. Of course, there's always the emergency department, but you don't want to wait till it gets to that. The local mental health centers, I think still depend. I'm not sure the situation in Ohio, but here in South Carolina, they still are seeing patients. But a lot of practices here, both psychiatric practices as well as counselors, are doing telepsychiatry, which actually this question kind of hits right on a topic that I wanted to talk about. Is with COVID has forced us to get more online, to use the virtual visits much more frequently than we used to. And telepsychiatry is not new, telemedicine is not new, but it is validated as a useful tool, and that has outcomes equivalent to face-to-face visits. But for young people, they might actually prefer seeing someone remotely, because it takes away a little bit of the stigma. You're not going to a practice labeled behavioral health center. You're not sitting in a waiting room where other people, or you may be worrying about other people looking at you. So there's a little bit of that anonymity that I think may work for some people. And then, but for other people, they may not like it. It feels more impersonal, or they may not be as tech savvy. So there are pros and cons to that. But services are still available, and they're still available remotely. I know counselors who are still taking new patients, even if it's visits that are done remotely, through HIPAA compliant, so HIPAA compliant media or forums, so the patient's privacy is maintained. And so that is something that I think is available in a lot of places, certainly available where I am. And so I would encourage people to reach out to, maybe if they have insurance, to look at what practices are taking patients, to find out if those practices are using telemedicine instead of face-to-face visits. But it can be really hard, because I agree, the number of practices that are taking new patients in the midst of COVID has decreased.
Thank you. I think